everyone, I am Vivek Verma and today I am going to take you through another very important topic, that is about the examination of swelling. So in fact, the swelling as a case comes both for orthopedics as well as for general surgery residents, and you must be thorough with all the points. And today this topic broadly covers the history taking as well as the clinical examination part of any swelling. As such, in our practice, we rarely see tumor cases, and by swelling, most of these cases are either tumor or some other differentials of it. But we must be able to elicit a proper history and clinically demonstrate the signs so that we zero down to the right diagnosis. So today in this presentation, I think few salient features that you all will learn. One, how to go about the flow of your presentation. So you must know how to start your history, significant points which needs to be uttered in front of the examiner. Many a times, which is called axing your own feet. So if you don't take proper history, or if you utter unnecessary history, this is going to just irritate your examiner and your questions will go in a weird direction. It may go to a different direction. So be very specific about when you present your history, especially the positive and the negative history. The different points of clinical examination. Many things we miss out. So which points are very important, I'm going to highlight and specifically elicit also. And finally, how do you summarize your history and examination so that you arrive at the right diagnosis? So whenever there is swelling, like I said, the most common diagnosis that comes to the mind is neoplastic. The neoplastic ones does not mean cancer. Neoplasm is any abnormal swelling which grows as compared to its surroundings in an uncoordinated way, and the growth persists even after that stimulus which caused it cease to exist. So in a simple term, it is like any growth of the tissue called neoplasm. It may be benign or it may be malignant. It may also be a pseudotumor. That is also a possibility. So that is the first type of swelling that you encounter, neoplastic. The second common cause may be infective, like osteomyelitis or an abscess which may present like a soft tissue mass. The third common ones may be due to trauma, mainly the myocytic mass or hematoma or malunited fracture, which may present like swelling there, and commonly mimics like a neoplastic origin. Among the infective causes, hardly you will get acute osteomyelitis where the diagnosis is very evident based on discharge, the redness, localized warmth. Most of the times it's either a cold abscess, which is commonly seen in cocks, or chronic or subacute osteomyelitis like features where acute presentations are missing. Also because in acute cases with fever or the patient is in distress, so usually in examiners avoid keeping such cases which may cause distress to the patient. The fourth common type of etiology which presents with a swelling is inflammatory. The common ones, like the ones which mimic tumor-like condition, may be monoarticular rheumatoid arthritis. Sometimes it may also be synovitis. And the fifth cause of swelling may be a congenital cause. So you may see in different conditions like multiple neurofibromas. You may see in Olier's disease, in Maffucci syndrome, just to give you examples, where there may be multiple hereditary, multiple exostosis. There may be multiple bony outgrowths in the body. In neurofibroma, you may see multiple skin tags like that. So broadly, when you take the history, this is a retrospective approach. Now, I'm giving you the key to present your case in the exam. So this key, just remember it, mug it up. This is the point which you need to ask to the patient to arrive at your diagnosis. So what constitutes your proper history? Your history, apart from the patient's symptomatology, it's ODP, the origin, duration and progress. The important positive and negative histories, you have to include and exclude all these conditions so that you arrive at the right diagnosis. So suppose if you are suspecting infective, rule out fever, ask for history of any discharge. If you take the history of why the history of trauma is important, because the patient may develop myositis. So these are very important positive history and negative history, which helps you in zero down to your diagnosis. So let us start how you begin to present your case to the examiner. Recently there was a 2-day program in one of the medical colleges in Delhi, and I was there as a faculty. So I realized, I was chairing the session and I moderated a session on swelling tumor examination. So I realized the students, they know the diagnosis. By the time you have examined the case, you are aware that this is a case of bone tumor or this is a case of soft tissue tumor, and you know exactly where it is arising after your clinical examination. But once you start presenting, you know, the flow is, you start with history and then you move down to the examination. Now, the problem is, and this is a very common sense that we all should be aware, and this is the key also, that when you present to the examiner, of course, do not manipulate what your findings are, but be smart enough to manipulate your history according to what you are finding there. Just for example, like one resident was presenting a case of osteochondroma, but he presented by saying that the patient has pain since last 2 years and started with pain. So automatically your history doesn't match with your final findings of osteochondroma. Most of the times these are painless swelling. The pain may be secondary due to other reasons. So be smart enough. The point is, whatever is your final finding, match up your history with what you're going to tell your examiner. Now, this is not something unethical what I'm telling you. What I'm telling you is to be smart enough, because your whole career depends upon these 1 or 2 days when your entire 3 year of hardships is judged by the person who is taking your exams. So you must be smart enough to present it in a way that you clear it all through and become a consultant. So one, avoid unnecessary information. If your any history is not pertinent, then don't utter it. Just say what are all positive points, and the negative points should be to rule out the other conditions. It should not be just you say no urinary difficulty, or if it is not related to your case. If it is related, definitely yes, but if it is not, don't say those things. One important mistakes what the residents make is that they give a histological diagnosis. So they say this looks like a case of osteosarcoma or chondrosarcoma or Ewing sarcoma or giant cell tumor. So remember, you need to give a differential. Rather than telling a histological diagnosis, you have to say this looks like a case of benign bone tumor, for say if there is a history of bone swelling which is there for a longer duration, or benign soft tissue neoplasm like lipoma, or sebaceous cyst. If it is aggressive, you may say that it looks like an aggressive bone tumor or soft tissue tumor. So the examiner like what? Then you can say at this age and this particular site likely to be sarcoma, like in this, considering the age and the site, you may say osteosarcoma, depending upon the case to case you have to present. Or in a soft tissue neoplasm, you can say looks like a soft tissue sarcoma. So don't go directly on the histological diagnosis. So I think these 1, 2, 3 points are very, very crucial when you present your case. And finally, I think having attended so many case discussions, what I have realized the mistake that the students make is they do not practice. Examination is not just about last day practice. You need to keep presenting it. If you are now a first year resident, do present to your seniors. Don't hesitate from presenting. Finally, in your exam, your case presentation matters. So the more you present, the more fluent you will be. Attend other presentations also, so you understand what examiners ask. What are the key points that is relevant in a particular case, whether today it's a swelling case, but whether it is a case of some organ like hip joint or knee joint, or for general surgery it may be some lump. So attend as many case scenarios as possible, so that the different angles, different questions, you are aware. So keeping your eyes and ears open, listening to what examiners are asking during your presentations is very, very important.